I'm Gargi Rawat. Did you know that most oral health conditions are largely preventable and can be treated in their early stages? But how many of us have ignored that? Toothache, skip brushing our teeth, or overlook bleeding gums? All of us at some point. Poor oral health hygiene affects our mouths adversely, bad breath, gum diseases, tooth decay, infections in the mouth, and eventually tooth loss. And that is why on World Oral Health Day, it's so important to create awareness around good oral hygiene. Welcome to our show, Decoding Oral Health of the Nation, a show where we talk about oral health care in India. And joining us on the show today, we have Lieutenant General Dr. Vimal Arora, Chief Clinical Officer, Clove Dental, and former Director General, Armed Forces Dental Services, Dr. Amit Sachdeva, Chief Product Officer, Ortho Prive, and Dr. Bhavani Nair, Zonal Clinical Head, Clove Dental. Thank you so much, doctors, for joining us on the program and to speak about this important issue and create awareness about oral health. Dr. General Arora, first to you, if you could tell us, where do we stand in relation to oral health and care in the country?
So, thank you, Gagi, for inviting us, and Jai Hind viewers. Well, your question is so very apt. Where do we stand? When you talk about oral health or the oral care, I think India has come up a long distance now in maintaining our oral health. When it comes to population in urban places or population which is educated, I think we are doing reasonably well. I'll use the word reasonably well in maintaining the oral health. But when we are talking of our rural people or people who are still, in semi-urban areas, there that much of information about maintaining the oral health is not there. If we see the oral health in the larger view of the country, probably the national oral health policy is just being made. The Government of India, Ministry of Health has already undertaken certain actions where the new oral health policy has already been circulated, and then Dental Council of India is going to come out with, so that the oral health becomes a priority, and then we can be sure that our population gets what they deserve to know about the oral health. Lastly, the awareness is something which we all are having a lack of awareness in our country. If I talk very grossly, I'll say that almost 86% of the population has one or more tooth which is affected, which is huge, which is unimaginable.
That's a very massive number.
And second thing is, when I talk about awareness to go to the dentist, then people only go to the dentist when it pains, when it hurts. Only then they go to the dentist. Otherwise, they're not visiting the dentist.
Right. So awareness culture of regular checkups is something we need.
And awareness to go to the dentist is less than 5%. I'll say 3.8 to 4%. That is what it ranges to.
All right. Dr. Nair, what are the most common problems that people come to you for, and what does that say about, the oral health?
Right. So, like General Arora said, pain is almost 80 to 85% of the patients. They come in reporting pain all the time. So, they always come to us when the treatment is not done. They have overlooked their initial stages of discomfort, and when it is in an exaggerated condition, they just come to us seeking a solution for the pain. And the pain could be due to many reasons. It could be due to cavities in the teeth, poorly maintained oral hygiene, and swelling in the gums, could be an infected tooth. So pain is the most common problem that they report to us with. Very few come with a preventive checkup, but of course in the urban areas it is changing, but rural areas and in semi-urban areas it's still the same.
All right. Dr. Sachdeva, is it that people have more irregular teeth now, or is it just that they're noticing it more?
So Gargi, actually there are both aspects to it. Firstly, yes, now people are having more amount of irregular teeth. So if you're actually going to look into it, close to 75% of the population has some kind of a tooth alignment problems. Now, this is predominantly related to the fact that evolution is taking place. Our faces are getting smaller, but unfortunately, we still have 32 teeth, and the size of the teeth is not changing. So there are a lot of places where we get to see a disharmony in between the size of the jaw and the size of the teeth. Simultaneously, there is a lot of crossbreeding which has been happening over the last few centuries. So as a result of which, we get a lineage of facial features and jaw structures which comes in from the father's side and a lineage which is coming in from the mother's side. So there is obviously a lack of balance which is actually occurring somewhere or the other. And over and above all, yes, I think we've all gone through the Zoom effect and the selfies. So even the minor problems today are actually getting noticed by people rather than actually looking at a big gross gap in between the teeth.
All right, General Arora, so what are some of the signs that one should visit their dentist?
Well, I will say, why wait till the signs? Why not go to the dentist? You know, dentists are nice people, they are your friends. I'll say visit the dentist. And if you ask me signs, probably earliest sign is, of course, pain, sensitivity, bleeding when you spit out after brushing, you see some streak of blood, and food lodgement, definitely. But more than this, today I want to bring you to the other side of the platform relating to not only to oral health. I'll say, if you don't look good and if you want to look good, first go to the dentist. Don't run to the beauty parlor, don't go to a salon, go to a dentist. Dentist will give you a smile which will be long lasting, which will be for your life.
All right. Dr. Nair, so what are some of the major myths around dental diseases and how do we overcome them?
So there are a lot of myths which have been circulated and percolated through generations, I could say, and that also prevents the population from visiting a dentist. The most common being that dental treatment is extremely painful. So in the fear of pain, they do not visit the dentist. And they assume that it is going to be expensive, and they don't even want to try what it works out for them. And the very common myth is that if you extract a tooth, it affects your vision. And if it's a baby tooth, you don't need to treat it. Like the milk teeth don't need any attention at all because they're going to fall off. Or that irregular teeth, they look cute, and spacing in your teeth is supposed to be lucky. So which is not true. Regular oral care is required for each and every person. And you just assume that if I consume a lot of sugar is only when I get cavities, and if I have a sugar-free, a Diet Coke, that is good for me and it's not going to do me any harm. But they don't realize that those drinks are very acidic, and that is definitely going to cause you a lot of damage to your teeth. So, and if I don't have pain, then I don't need to visit a dentist. Or if my toothache settles, then again I don't need to go back to my dentist. So these are some of the common myths that we carry around for generations, and it just percolates, and people, it just stalls them from visiting a dentist.
Dr. Sachdeva, can a correction of irregular teeth happen at any age?
It's one of the myths where that teeth correction can only happen when you're in a growing age. But technology, as in every other field, has completely taken over in dentistry also. So we have lovely digital tools. And today we are able to offer treatments with the help of, a product called aligners. Aligners are non-metallic, customized medical grade polymers which are made from a technology using 3D printing. We can use this in relation to any age without causing any harm to the bone structure of the individual. So whether you are at the age of growing age, at the age of 7, whether you're 20, whether you are even 40. One of my oldest patients is 63 years of age, because that is how we are able to kind of align the teeth, not just for the purpose of maybe looks, but also for improving the bite.
Why is it important to correct the bite?
Yes, because if you don't correct the bite, it's how the teeth meet. If the teeth are not going to be meeting in a proper manner, the forces of the bite abuse the structure of the teeth, as a result of which the enamel is lost, and enamel is irreparable.
Right, General, you'd like to add something?
The biggest problem is that today when the kids are preparing for their exams, then they say that we can't have braces because braces is difficult to wear. Or a girl who is working, she says, now it's my career, I can't wear braces. That's why this new age aligner has been introduced. And in India, aligner is almost taking up 60% of our workload. almost 60% of our patients are going for aligners. Biggest advantage is it is absolutely invisible. Somebody sitting next to you at 6 inches will not know that you are having any aligners put. You can see well before the treatment starts that what will be the end result. So it's giving a predictable result, which is possible with aligner because the latest technology of scanning the teeth, putting it through the, the simulation and correction, so you can show the patient this is what you're going to look in 10 months' time, and this is what you're going to look in 24 months' time. And patient can make a very, informed choice and give a consent which is much more appropriate.
Right, so the advancements of technology in oral
Yes.
healthcare has grown by leaps and bounds. With that, we'll just slip into a short break, but don't go anywhere. We'll return with more questions for the doctors. Welcome back. We're talking about oral health today, and before we went into the break, General Arora, we were talking about technology and the role that it plays in healthcare. If you could tell us how technology is changing the outlook towards dental health treatment.
I think that's my favorite topic, Technology has brought in absolutely a revolution in this field of dentistry. We are doing dentistry much better now, much quicker, without pain, and we are able to give predictable results. If I look at, a couple of years back, say a decade or two back, we were unable to treat many cases which are possible today to treat them. Like if we can now prevent the disease to happen with our technology. We can prevent a malocclusion to form. We can prevent sleep apnea. We can prevent snoring. We can prevent open mouth syndrome where patient is keeping or child is keeping his mouth open in the night. We can treat irregular teeth now much more confidently, and we can predict our results that where we will go. The CAD/CAM technology and the digitization has really brought in a revolution. We can literally do a chair-side crown in half an hour, which earlier used to go to laboratory. Gone are the days when we were taking impressions with the help of a tray that, you remember that tray full of material used to be thrust in your mouth and you are, choking and you're poking. Gone are the days now. Now you get a scan, which is like a camera, so you move it in your mouth, that's the end of your impressions. And based on that, we can literally constitute anything, we can fabricate anything, and we can build anything. I can go on, but I think this is what very broadly I will say is what is happening in the technology.
All right, earlier we were speaking about, looks and dental health as well. So Dr. Sachdeva, if you could tell us, are quick fix cosmetology, products a solution to long-lasting beauty?
I think God's given us a beautiful structure in which we have our teeth, which basically support, all our cheeks, all our lips. And, these are one of the features which basically get enhanced over a period of time. And as you see in case of when you're growing, as people grow with age, they start complaining of wrinkles, they start complaining of the fact I've got lagging skin, I've got drooping, sides which are all happening. All this in the end is basically related to, in our language, what we call as the lack of a vertical height. And that vertical height is basically held by the way our teeth meet into each other today. So if we are able to naturally control the vertical height throughout our life, automatically our face height will not deepen up over a period of time. So you don't get up at the age of 45 and say, why do I require anti-aging creams on the face? It was really not required if your deep bite had got corrected way earlier in life. If you had had loss of teeth and the teeth were substituted at the right time, they would have actually remained, your vertical height would have remained perfect. Your lip structure, would have got supported by your teeth much better if they were already, the teeth were placed in something which is called as a neutral zone or a fair zone. So as a result of which the lip curvature would have remained in a proper kind of a manner, which today lot of quick fix cosmetic products come and say we're going to add volumes, we're going to add structure. Why do you need all that when, if you've treated your teeth and your bite and given them a good, nice, regular structure, that would have given the longevity to your face structure also over a period of time.
All right. Well, the mouth is the window to your body and health. So, doctors, I'd like to ask you now to explain to our viewers in simple terms the connection between oral health and overall health. And General Arora, let's start with you.
Yeah, that's a very beautiful topic, talking about oral health and general health. But I'll say oral health, general health, and the beauty. All three are oral linked. So oral health is not only linked to general health. Like, most of the systemic diseases, viral diseases, what we have, the first telltale sign comes in the oral cavity in the form of some ulcer or a small spot. And it is not known since now, it is known since ages. Women especially who pass through certain ages, they go through much stronger reaction of their gums during the age of, right in their ages of hormonal changes, and the gums react very severely if the gum disease is existing in the mouth. Similarly, it is known that there are certain such bacteria in the oral cavity which have been isolated, which are strongly linked to cardiac, which are also strongly linked to the pulmonary diseases. So this is known that that these bacteria are responsible. So are they really causing it? I will not say that 101%, but I will say that they will aggravate an existing condition to a level which is much more difficult to handle. And when you move further, then you say that definitely osteoarthritis and oral health is definitely linked. If you talk of cognitive disorders, there is definitive proof that neurocognition is affected. That is your memory loss or your cognitive impairment is also there. When you lose plenty of teeth, you have cognitive impairment. And lastly, but not the least, is low birth weight babies in mothers who have poor oral health is a definitive proven scenario, and that is why we always tell our medical counterparts that whenever you get a person who is coming to you, send us to the dental field so that we can make sure that it is working. Lastly, all wellness programs in the hospitals today, we are insisting that in any hospital that include dental element positively in that. Patient must get through dental screening done. But this is coming up, this awareness is coming up slowly. It's a constant strive for action towards this, that everyone must get through a dental screening so that there is no pus in the mouth. Because pain is definitely, the person knows, but a silent disease, person doesn't know. That's why we are insisting upon this.
Right. Dr. Nair, the connection between oral health and overall health.
Yeah, so basically it all starts with the mouth. They start eating, so your saliva is there, your digestion starting point is the mouth. So invariably your digestive disorders we can detect faster. They're very silent and they're probably not so exaggerated. The patient doesn't think they need treatment, but we routinely diagnose these problems. Even their bad breath, the kind of breath tells us whether it's a kidney, could be an underlying kidney disease or indigestion or diabetes is also a common thing. So with a smell of the the breath, we can easily diagnose something like that. And acidity, gastric reflux, it eats away the enamel of your teeth. So one look at the teeth and we can tell you that something is not right inside. So you'll be amazed to know that in India, only 51% of the population actually uses a toothbrush and a toothpaste to clean their teeth, and which means 49% are not even using the right basic dental aids. They are making do with the whatever the leaves and the twigs. Although as Indians we tend to Ayurveda and natural treatment, but then I think we are all into processed food. So we haven't graduated from there to the cleaning. The cleaning aids are not used at all, and they are unaware of their medical condition as well. So a regular dental checkup can go miles in maintaining your dental health as well as taking care of your general health as well. So if this is neglected, then it does affect your health.
Right. And Dr. Sachdeva, what would you like to add here?
Yeah, I think the only thing I can add here, I think everything's been said. It's predominantly, today's lifestyle changes. So if you look at a healthy set of teeth is also a happier person. The minute we actually kind of see the smile, confidence coming in, there is a lot of peer acceptance which happens. And this is exactly what we have seen a lot in kind of teenagers, who are stuck at home because of a certain lack of ability to smile. They actually undergo a lot of depressive changes. So it is really a good, happy, confident smile is very essential for a proper psychosocial development of the child. Because the peer acceptance levels, you are no more called a nerd or a bunny teeth or stuff which may be addressed at school level but can really affect the growth of the child. Simultaneously, the position of the jaw today is actually leading to a lot of disorders of sleep apnea, which are predominantly responsible for everything going wrong in the body. Imagine just increasing your airway by a millimeter can reduce your snoring and your obesity and your cardiac conditions by 30%. So that's the limit of how good oral health can be associated with a good and a happier, healthier life.
All right. Well, thank you so much, doctors, for joining us on this program and creating awareness. So clearly, good oral health has an impact on our overall health. Thank you, doctors, and thank you all for watching at home. Goodbye.